Nigeria, Africa's most populous nation with about 170 million people, with its beautiful capital in Abuja and a great commercial center in Lagos. This giant of Africa is not without its HIV/AIDS prevalence. It currently has a reported HIV prevalence of 3.4%, next only to South Africa in the sub-Saharan Africa region.
Over the last 10 years, beginning from between 2003 and 2013, Nigeria has actually succeeded in reducing the incidence of HIV by 54%. And the number of people on treatment has increased remarkably to over 750,000. The number of deaths from HIV is falling, has continued to fall over the years. And also the number of new children who are born with HIV has also continued to reduce. And this year we witnessed a very successful story of Pempeda community where mother-to-child transmission has been eliminated. For the past 3 years, not a child has been born with HIV in Pempeda community. All the other indices have continued to show a positive trend, which is very, very good. And so Nigeria is one of the 22 countries in Africa, sub-Saharan Africa, that actually has succeeded in reversing the trend, where HIV incidence is falling continuously. The prevalence is also falling. The recent data on HIV, the antenatal NNC data, shows that we are also on a downward trend from 4.1% in 2010 to 3%, which is very, very significant.
So we actually have not only halted, but we have reversed, the trend of the HIV prevalence in the country.
The United Nations has set an ambitious goal in the treatment of AIDS.
By the year 2020, 90% of people living with HIV will know their HIV status.
For those who are diagnosed with HIV, 90% will receive sustained antiretroviral therapy.
And of all people receiving therapy, 90% will have viral suppression. This is the 90-90-90 plan, and NACA is committed to it.
The global community recently adopted a 90-90-90 strategy. And within the next 5 years, between now and 2020, if we faithfully implement the 90-90-90 strategy, we will definitely achieve an AIDS-free Nigeria by 2030.
And doing so essentially would mean that they don't transmit HIV to their partners, and consequently it has a population good, or a public health good of actually drastically reducing the issue of HIV and getting to zero.
As part of the 90-90-90 strategy, NACA, with support from the MDG, began a nationwide NACA MDG health clinic and HIV counseling and testing campaign.
In 2013, NACA, working with stakeholders, produced the first presidential response plan in Africa, which was called the Presidential Comprehensive Response Plan.
One of the targets of the Presidential Comprehensive Response Plan, the PCRP, was to test 80 million Nigerians by December 2015.
And which should include at least 4 million young people. So what the HCT campaigns has been an attempt to contribute to this national figure of 80 million people that should be tested. And so the outreaches have held across the country in various settings, including universities, including rural communities, urban centers, guided principally by the epidemiology. That means guided by the studies that have been carried out previously that tell us where we have high burden of HIV. The focus has been, first of all, that we identify people who are HIV positive and we link them to the appropriate care that they should receive. And secondly, that people should know their HIV status, and in so doing, do what they need to do to keep themselves negative.
The global community agreed on 90-90-90-90. These 390, the first one is 90% of those who are HIV positive should know their status. And one way of knowing their status is through HIV counseling and testing.
The entry point is testing. And that's also the entry point for the 1990 strategy. And you know that there's massive testing going on in all the states. And more importantly, we have been strategic in the way we are doing it.
Before you can make progress in treatment and care, you must know your status. So the drive has been to get as many Nigerians as possible to know their HIV status, and move as many people as require treatment into the treatment program, and subsequently into care in the long term.
We go into communities where there's a higher burden of HIV, and that means that therefore you can actually identify more people who are positive, and in the process of doing that, people who are positive are linked to treatment. So I think that's really a huge component of what we're doing. But other areas are also being addressed.
So the activities I've been carrying on is something called an integrated multi-disease prevention campaigns. And so the idea is to look at various common conditions that are affecting our people and find an opportunity where people can access health care as well as health information, as well as HIV counseling and testing, have access to health commodities like bednet, condoms, have access to tests that they otherwise wouldn't have, blood pressure checks, obesity assessment, hepatitis tests, malaria tests, etc.
Yeah, for now we have, for this local government, we are looking at 4 centers. We started with the 4th center today. By tomorrow we will be going to another center, and the strategy is we are looking at a place where you can have people like marketplaces, like bus stops.
From the beginning, when we are coming, they tell us that to sit down. Then they gave us cards. After that one, we go and register. They register us. After we are registered, so we go and do the HIV test. After that, they rate us. Then we do the diabetes test too. From there, we go and see doctor. So doctors tell us, they then carry us and they can tell us about the HIV test. So they wrote the medicine, they give us medicine that we are using for what we are complaining. They ask us, maybe we have any complaint that we have, apart from the test they do for us. If we have any complaint, we will test, so they will give us the medicine for it.
And after that, well, if the person is positive, we refer the person to a bigger facility. Now, the person can go to Shomolu General Hospital, but what we've done is that we've been a bit flexible. We actually have like a list of referral facilities. So the clients can say, oh, I don't want to go to Shomolu, maybe because of some stigma or because the person feels like everyone will know, and say, oh, I want to go somewhere else. That flexibility is here. So wherever the person decides to go to, it's fine. We will take the patient's contact details, that name, location, where the person stays, the person's phone number, next of kin, so that we can reach the person and then follow up care.
We're compiling data on demographics, name, age, diagnosis, things like that. So we'll look for trends in this community, in this local government area. Well, there's still a stigma attached to HIV and AIDS. So in order for us to come into the community, we just can't come and say, oh, we're testing for AIDS. So we come and say, we're going to do HIV awareness, plus we're going to offer these additional services. And we put it in a package to present it to the people in the community to be more acceptable.
The most interesting part is the test. The test they conducted is very interesting. I love it, but for me, it has been long I conducted any such test. Like I did my HIV 6 months ago, and I'm doing it again now. The blood sugar, high blood pressure is very interesting.
In fact, I'm very, very happy about it, because many people are there, which they don't have money, and they are dying in the house. If the government can continue this for masses, in fact, it will be very, very good for the government.
So as you can see, we just have an outreach at a point, but the mobilization is done from within the environment, so that we capture most of the people within this particular place there.
I think as zuwa kowane lokaci ana duba lafiyar mu. Sai mu ji dadi. Mun gode.
I'm very happy for doing this test, most especially the HIV test, which have not been done for a long time. But now I thank God that I did the test and it is negative. And my advice is that more people should come for the test, because it's very nice for people to do it.
Godiya ga Allah Ubangijin Allah madaukaki sarki da ya ba mu gwamnati na yanzu. Muna roke su ci gaba da mu haka. Domin zobi cucuka su yawa kuma ba kudi a kasa. Yaya za mu yi? A taimako, a yi taimako da ga Ubangiji. Mun gode. Allah ya masu albarka.
Please, I would always like to see it go on again.
So the strategy is essentially to offer people a little bit more than HIV services from a one-stop shop, as it were.
And one of the key advantages of this approach is that it destigmatizes the HIV testing because it normalizes it. It makes people think that just like I can have a malaria test, I can see a doctor, I can, collect a condom. It's simple, it's easy to have a HIV test. It's so important to demystify HIV for the common person so that people will be more willing to test. Not enough people are testing in this country. We still have fairly low rates of testing. About 17% from the NTHS show that had HIV counseling testing in the last 24 months. So there's still a lot of work to do. So these outreaches are a way of normalizing that process and getting people to go out and know their HIV status.
And this is supposed to contribute to achieving that goal, the community outreaches that was carried out.
For Nasarawa State, we're having it in two locations, but specifically for Akwanga, we decided to have 3 sites. The first day we had it in